Hi, I'm Shashank Bhargava, and you're listening to Three Things, the Indian Express news show. Dr. Khilani, you have been in the city for a while now. Do you recall a time when the air quality in Delhi was actually good?
Of course, we all know that the air quality in Delhi was amazing during COVID times. When there was no traffic on the road, there was no movement, there was no factories running, the schools were closed, and you could see the blue sky which you see in New York, San Francisco, or Europe. That was a time, and I have a picture of it which I keep showing, and I show the India Gate, which is so clearly visible. Besides that, Delhi always had a very bad air pollution, especially in winter season.
That's Dr. G.C. Khilani. He's the chairman of the Pulmonary, Critical Care and Sleep Medicine at the PSRI Hospital in Delhi. And he's also a member of the Technical Advisory Group on Air Pollution and Health at WHO. And in today's episode, we are dedicating the conversation to speaking to him about everything related to air pollution. What AQI levels actually indicate, how air pollution affects our bodies, the steps individuals can take, and what the government can do to reduce a city's pollution by half. And while this conversation is centered around Delhi, it has important lessons no matter where you are in the country. So here's Dr. Khilani telling us the reasons why the capital's pollution is so bad.
So Delhi's air quality is bad, one, because of the geography, because it's a low-lying area, is a part of the gigantic region where the air pollution is high, but Delhi is highest. As you know, it is the worst polluted city in the world, and there are so many reasons. So one of the reasons is the transport, that is vehicles. The number of vehicles in Delhi are more than Calcutta, Chennai and Mumbai combined. So the numbers are too large. Although everything is there, that pollution check is there and certificates are there, but there are issues about engine quality in city of Delhi also. So that is, transport is one.
And is that the biggest contributor?
More or less, yes. That is the biggest contributor on an average. It depends upon season. But if you take annual average, then transport is the number one cause of air pollution. Besides this, the road dust and the construction dust. That's a very big contributor which is less talked about. You would have seen that, big trucks moving, and if you are, or buses for that matter, if you are driving behind, you can see actually dust coming up. And every fourth house is being reconstructed or constructed, and demolition is going on, and the norms are not followed. So the construction and demolition is another cause of air pollution. Besides this, 3 to 5% of the air pollution comes from the burning of the waste, municipal waste, which is done by the government, not by the people, and which is actually preventable. And if you talk about tandoors, there are 9,000 tandoors in this city, for making chicken tikka and paneer tikka, and they all run on coal and wood. So they are also a big source of air pollution.
And besides this, what is also highlighted when it comes to Delhi are outside factors, right? Can you talk about how much they contribute to the city's air pollution?
So one important thing that we need to understand, that Delhi pollution is not only generated in Delhi. A large proportion comes from outside Delhi, even from Afghanistan and Pakistan, Punjab. And if we talk about, say, distance of 300 kilometers within Delhi, there are many electricity generating plants, and except one, all are using coal. And this is a big source of air pollution as far as the Delhi and NCR is concerned. And this is exemplified if you know that 10 worst polluted cities in India are Delhi, Gurgaon, Faridabad, Noida, Hapur. They are around this area only. So this coal burning for electricity generation is a big source of air pollution. Besides that, of course, stubble burning, which is a periodic thing, and as I said, even from Pakistan, Afghanistan. And I have talked about sources, but one of the reasons that the air pollution continues to be worst in Delhi is the wind speed. Delhi geographically is a very low-lying area. So the only thing which reduces the AQI, as you must have read in the newspaper, that wind blow was good, the wind speed was good. So therefore, the air quality improved.
Right, whenever the wind speed is high or it's not cloudy, the air quality improves. But you mentioned stubble burning, and that makes so many headlines. How much does stubble burning actually factor into Delhi's air pollution?
So stubble burning, anything between 5 to 18%. This is a rough figure, and these are estimates actually. It depends upon the quantum of stubble burning, the area of burning, and also wind direction. All those things matter, but the maximum, what I have come to know with my knowledge, is about 16 to 18% of the pollution coming from, but that is episodic. But the AQI in Delhi 12 months is much, much above any acceptable limit. And if you talk about WHO standard, you might be shocked that the WHO average of PM 2.5 standard is 5 micron per cubic meter, whereas we are living at 250, 300. And WHO daily is maximum is 15 micron. The 5 is annual average. So we are in trouble, and it's not new. It has been there for decades actually.
And does the air quality get particularly bad during the winters, or it's just that we can see smog in the air?
So what is smog? Smog is a combination of fog and air pollutants. When the temperature is down, the humidity is high, the air pollutants get trapped, and there's something called inversion. Inversion is that air pollutants, instead of being equally distributed in the sky, in the morning time when it is cold, it comes down at a breathable surface level. With that, visibility goes down, but also the concentration of air pollutants is extremely high. Whereas in summer, despite the same vehicles and they go up. So that is why the effect is much less, because the fog is not there. When the fog is there, winter is there, air pollution there, the smog occurs.
And you mentioned a couple of factors that contribute to air pollution. You mentioned vehicles, you mentioned construction, garbage burning, stubble burning. Are they emitting different kinds of pollutants? And if that's the case, then how do those pollutants affect us differently?
Yeah, so that's an amazing question. PM 2.5 from the petrol engine would be different from PM 2.5 from the diesel engine. Because diesel engine will emit lot of what we call it polyaromatic hydrocarbons, which are carcinogenic. Whereas the petrol emission would cause more of asthma. Similarly, the PM 2.0 from firecrackers would have arsenic, thallium, potassium, very toxic substances which gets deposited. PM 2.5 from the road dust would be different. PM 2.5 from the construction and demolition will contain lot of fungi, like this. So PM 2.5, it's only something that we can measure and say.
And for those who might not know already, can you tell us what exactly PM 2.5 is? Because that's all we hear about these days.
So you should understand that why these figures are quoted all the time, because this is called aerodynamic diameter. How they are formed? They are formed by a complex chemical reaction of noxious gases and other particles in the air. So PM10, why don't we talk about PM15 or PM20? After all, they are also small particles.
And this is the size of the pollutant.
Size of the aerodynamic diameter of the particle. The particles which are more than 10 micron are filtered by our nose. The God has provided with that filter so that the foreign particles do not go in. So they cause cough and sore throat and blah blah blah. But the particles which are smaller than 2.5 micron, that is called PM 2.5, they go to the lowest part of the lung where gas exchange takes place, and they cause short-term as well as long-term diseases in the lung. But I would also like you to know there is something that we don't talk about, is ultrafine particulate matter. This is PM 0.1 particles which are smaller than 0.1 micron. These are the particles which penetrate the lung and go into the blood vessel. What is lung? Lung is a filter through which the oxygen goes into the blood and carbon dioxide comes out. And with that, other things also come out. But the particles which are less than 0.1 micron, they pass through that what we call as alveolus, go into the bloodstream and go into every part of our system. Like it may be brain, it may be eyes, it may be heart, it may be blood vessels, it may be kidney, intestine, and everything. That is why the air pollution affects every organ of the body, and it is affecting our longevity as well as the quality of life.
And so when we look up the air quality index, the AQI of a place, and it shows us 200 or 500, what exactly is that number telling us? What does that number mean?
So the AQI that you hear is actually not made of one parameter. AQI was sort of formulated in year 2012. There was a committee under the chairmanship of Dr. Mukesh Sharma, who is a professor of civil engineering in IIT. There was a 10 or 11 member committee and I was part of that, and we sat down and discussed the health effects. So AQI is made of 6 parameters. One is of course PM 2.5, other is nitric oxide, other is sulfur dioxide, ozone and lead. Lead is no more very serious issue because it has been taken off. So each parameter is given certain strength in that calculation. The final thing which comes out is a one parameter AQI. So it's not, AQI should not be equated to PM 2.5. It's a mixture of all the 6 air pollutants. But while PM 2.5 affects the lung, nitric oxide, sulfur dioxide, carbon monoxide, these gases will easily pass through the lung and go into the blood, and they also cause their own harms, and there are various adverse effects.
And so right now, are we measuring all these different kinds of pollutants?
Yes, the Central Pollution and Control Board measuring all the components except ozone. Ozone is not easy to measure, but they are measuring it for research purposes. But on a daily basis, ozone is not published. The rest of the parameters are regularly monitored at various stations by Central Pollution Control Board.
And we all know that pollution is bad for us. And we hear all the time that breathing in bad air is like smoking cigarettes and it reduces life expectancy. And in fact, some people react to that by saying, I'm fine losing 5 years of life. I don't care that much about air pollution. But can you stress on how air pollution affects our quality of life and what are its long and short-term effects?
So I'll talk about first the short-term effects of air pollution on us. And if you talk to any Delhiite today, you tell him that, look, I have some very bad throat, my throat is so scratchy, I have running nose, I have got headache, and I'm coughing. Sometimes I have to cough through the night. You will never get a sympathy because everybody has it. So they will say, okay, you have it, I also have it. So it's what we in French phrase you call fait accompli. This has to happen every year. But this is not the only thing. Besides this, your feeling of well-being is affected. You feel more tired in the evening. Your appetite may go down. Quite importantly, slight heaviness of head is there. And what is lesser talked about, our sleep gets affected. If you are in a cleaner environment, you are more likely to sleep peacefully. But even without cough, the sleep quality gets affected.
And as someone who sees patients regularly, can you talk about the kind of problems you come across on a daily basis?
So, about a month back, when I was sitting in my OPD, the AQI was still in the 200 around category, but the pollution had started setting in. I got 5 consecutive patients who were my old patients who were happily living their life on inhalers or whatever treatment. Consecutively 5 patients came. That we have increased cough, we have increased breathlessness, and we are unable to sleep, we have to sit up through the night. And when I asked the history, they said we have no fever whatsoever. I do their x-ray, that is normal. And then I do their one test called fraction of exhaled nitric oxide. That is, one exhales into a machine and we measure the nitric oxide, which is the measure of airway inflammation. All these patients have a high level of exhaled nitric oxide, which told me that they have airway inflammation. So that means that there was increased inflammation due to the air pollution, which led to exacerbation of their asthma or bronchitis or other respiratory elements. Some of them also landed up into the ICU. And not only that, those patients who were admitted with respiratory elements during the high level of air pollution, their response to treatment was very poor. Instead of improving, despite the treatment which we thought was giving was appropriate, they were not responding. At least 2 of my chronic patients with respiratory diseases, they got admitted. They knew it was because of the air pollution, and one knew that it was because of firecrackers, and he was unwilling to go home. And his response to the treatment was extremely poor. And this we know that even a viral infection, which should be trivial, at the time of air pollution, it may take a serious turn and person may land into the ICU. There I also would like to tell you that children, young children, less than 5 years of age, and the elderly more than 60 or 65 years of age, and those who are having heart diseases or previous lung diseases, or those who are immunocompromised because of diseases or chemotherapy or cancers, they are the people who are worst affected during this time.
And there are a lot of people who claim that, they are not being affected by any of this. So are they just not noticing some of these symptoms, or have they just sort of got used to it?
No, those people who have allergic tendencies, those who are what we call technically as bronchial hyperreactivity, they are more likely to be affected. After all, if you give insult to 5 people, they react differently. So this is an insult to our lung, and everybody's lung will react differently and with different severity. So, and there are so many people who are traveling abroad, and they tell me, and I also keep going. When I go to the Western world, I go for morning walk, same person, same age, me. I walk for an hour together, I don't get tired. And whereas here, I don't have that much energies or whatever you call it. One gets used to it, you stop complaining because it has been the visibility for that matter. If you land in the developed worlds and come out of the aircraft, you feel their vision is improved. And I would also like to tell you what is the evidence that from India, scientific evidence that there are short-term implications. About 30 years back, there was a study conducted at the All India Institute of Medical Sciences, which I was part of that. That's a published study where we collected the emergency visits of patients with asthma, COPD and heart attacks over a period of 1 year and correlated with the level of air pollution. What was the conclusion was that there was 22 to 25% increase in the rate of heart attacks, bronchitis and asthma attacks in response to the air pollution in last 48 hours. And actually that was the study which led to the Honorable Court taking cognizance, and that time the CNG came and all the industries were asked to go 50 kilometers away from, and that's how the Delhi air quality somehow improved in late 90s.
Okay, so far we have been talking about how our body gets affected immediately. What are the long-term effects of air pollution?
So first I will talk about the respiratory effects. And if you talk about asthma, and today every third child has asthma, and every other house who have young children have nebulization machine, whereas the incidence prevalence of asthma in Indian children is about 5% or 10%, but the Delhi children have the lung capacity of Delhi children, as done by a study at All India Institute of Medical Sciences, is much less than the lung patients of Tirupati. This study also is a published study long time back. The COPD, chronic obstructive pulmonary disease, commonly causes bronchitis. And when we were studying, it was 90% was caused by tobacco smoking. And in India today, that COPD 50% is caused by outdoor and indoor air pollution, and COPD is third leading cause of death all over the world. Talking about lung cancer is number one cancer killer all over the world, more than prostate, breast, colon. So lung cancer in the Western world, 90% is caused by tobacco smoking. Whereas in India, 40% it occurs in non-smokers. And it is attributed to indoor and outdoor air pollution. And of course, we have already talked about acute exacerbation of asthma and COPD, which is caused by air pollution. So, as I talked in the beginning, that air pollution does not confine itself to lung, it percolates from lung to the all parts of the body. Almost every cancer, starting from intestine to urinary system to even reproductive uterus, ovary, the incidence of cancer is higher if you are living in a polluted environment. Besides that, heart disease also occurs more because of obvious reasons. And everything culminates into quality of life and quantity of life. So, India got, at the time of independence, the life expectancy at birth in India was 32 years. Now we are at about 72 years. And the Chicago study, which was published in October 2023, estimated that because of the air pollution, that average life expectancy of Indian at birth is reduced by 5.3 years and 11.9 years for Delhiites. So this is very important for all of us to know that it's not about Delhi. 99% of the Indians are living in the area where the air pollution is more than what WHO standards say.
Yeah, but WHO standards are like 5 and 15. So, do we know how badly our bodies get affected at, say, 200 AQI versus 500 or 800?
So, more the level of AQI versus the. I don't have the quantification of this. I'm not aware of any study. But the longitudinal study is done. There's something called Boston City study. And the best evidence of effect of air pollution was documented during COVID, where in Italy, you would recollect the initially Italy was worst affected. There was very high mortality, and the mortality in the North Italy was 4 times higher than southern Italy because the air pollution in North Italy was much higher. Similarly, the mortality in Germany and other part of the Europe, it was found out that if the NO2 levels were more than 100, the mortality was much higher as compared to if it was between 50 and 100. And if they're less than 50, the mortality was much lower. Similarly, in United States, each microgram increase in PM 2.5 led to higher mortality with COVID. So any infection, that only exemplifies that any infection, be it any viral infection, if the pollution is high, it becomes worse and the outcome also becomes worse.
And you were talking about vulnerable people earlier, and I was thinking about pregnant women. Does air pollution affect the fetus?
Definitely. Excellent question. So, before the pregnancy, it affects the fertility also. Air pollution also affects fertility, it also affects sperm count. But the fetus, yes, there's more incidence of what we call as intrauterine growth retardation, IUGR, more incidence of miscarriages. Also, the child which grows in the womb when the mother is exposed to poor air quality, his onward growth, even after taking birth, their growth is affected. So it's quite serious actually.
And so, considering this and considering you see patients who get admitted to the ICU because of this, do you recommend people moving out of the city? And I know very few people can actually do that, but have you recommended that to people?
All the time. And actually it is happening that my patients who are chronically ill, those who have chronic lung disease, severe asthma, those who are on oxygen or who get repeated attacks, or those who can afford to leave city for 2 months or 3 months or even 1 month for that matter, I advise them to leave city. And the young people, young technocrats who are based in developed world and want to come back to India and they have small children, Delhi is not a preferred place for them. They prefer to go to other cities because of this, because they are aware that their children's health will be jeopardized if they come to Delhi.
And which place do you recommend they go?
So everything is relative. So if there's a technocrat is there, even Bangalore or Hyderabad or Mumbai will also be better. But Mumbai I was see, so their air pollution is better. So that is how it is.
And for perhaps the 99% who can't leave the city, what are the things that they can do? And maybe we can start talking about masks. Does wearing a mask help?
So during COVID time, there was not a TV channel where I didn't go saying that please use simple mask, cloth mask, 3-ply mask and protect yourself and protect others. Unfortunately for air pollution, WHO doesn't agree that any kind of mask works.
So WHO is saying that masks will not protect you against air pollution.
Air pollution. WHO said that. But my thinking is that since WHO has got studies which are done on AQI of 25, they haven't studied the AQI of 300, 400, 500. So certainly the cloth mask or simple mask or 3-ply mask does not help. If something helps is N95 or there's something called KN99 mask. So if somebody is susceptible and he has to go to crowded market or he has to move out in a crowded place or air quality is very poor on that particular day and he must go out, then he should use N95 mask and not a simple mask. That is about the mask. And of course, initially you do feel claustrophobic. You find the breathing out is difficult. Only one thing is that COVID time we said don't use mask with a valve because you will be emitting virus into the system if you are infected. Because the breathing becomes better when you use a valve mask. But pollution, you are infecting nobody. So you can use a mask with a valve if you feel more comfortable using that.
What about air purifiers? Do they help at all?
So what is air purifier? Air purifier has got two components. One is a filter which filters 2.5, PM 2.5. Another is adsorbent, AD. Adsorbent that absorbs the gases like nitric oxide, sulfur dioxide, carbon monoxide, and the air which comes out is purer. And nowadays the air purifiers will demonstrate whether it's pink or blue or whether it's 30 or 200 or whatever. So presumably the air that you breathe is better. But one thing that there is a way that you should use your air purifier. Number one is that air purifier should be of the capacity which is commensurate with the volume of your room. It is not that you procure one air purifier and keep it in the living room and think that your house is purified. That is not there. Secondly, the room has to be completely closed. All windows and doors should be closed. Third thing is that the flow of air from the air purifier preferably should be an area where you are there. So if you are sleeping, then it should be in that direction. Fourth thing is that the filter should be replaced as per the recommendation. It can become a source of fungal infections if the air filters are not. Windows and door, if you keep opening for tea, coffee, food, somebody coming out, it becomes useless. And lastly, the WHO doesn't agree that air purifier leads to improved health. But my thinking is that because I was in Geneva in a meeting as a member of expert committee and I sort of argued that your studies are at AQI of 50 or PM 2.5 of 30 or 20, but we are breathing at PM 2.5 of 200, so same recommendation cannot apply. So they said we have no evidence that it helps in the health, but I think the air purifiers are good. And one thing which I must emphasize that it should not be used like air conditioner, that when you enter the room you put on the AC. It should be on all the time.
And you mentioned keeping doors and windows closed, but one thing we have heard often in the past regarding indoor air pollution is that there should be proper ventilation. So what is a good time to actually ventilate your house?
No, but the thing is that good windows is there if you are cooking in that room or you are doing some activity which generates some fumes, then the windows should be open. Otherwise, it doesn't matter.
And any other tips for people who want to step out? Any places that they should avoid? And also, what is the best time to exercise?
So, few tips I would like to give. Those people who are susceptible, and I've already said elderly and with diseases, they must not go to crowded markets. Because air pollution, when you say AQI is 300 or 400 or 200, it's not uniform. Like if you measure the air pollution at the intersection, a busy intersection, which may be ITO or Chirag Delhi or whatever, it will be very high. And if you go from there 20 meters, 50 meters, it will keep on reducing till the time a plateau comes. Similarly, if you go to the crowded market, and I need not recite those names, it's not good. Those kind of markets, you feel choked actually, where actually the air pollution is very high. So those things should be avoided. And of course, when the AQI is bad, one should not think of exercising. Early morning exercise in city of Delhi during winter is big no-no. As I told at the beginning that because of the inversion, the air pollutants are at the breathable level. So we breathe about 500 milliliters of air with every breath. And when you exercise, then you breathe, especially when you jog, this quantum becomes 5 times. And inevitably your mouth will open and you will breathe more through the mouth than your nose. So that filter gets bypassed. The whole air which you are breathing directly goes without filtration in the lungs. So the adverse effects of pollutants are much more in the morning. So therefore, big no-no for early morning when the smog is there. However, if you have time when the sun is bright, which is uncommon in Delhi, that is a better time to go for walk and stepping out and doing some exercises. And there is an evidence for that. I should not be talking without evidence. There was a very elegant study conducted in London. What they did was people above 60 years of age, they made them walk in the Oxford Street where a lot of diesel buses run, and did their lung functions before and after the walk. And they documented that their lung functions diminished after the walk. And they also did some inflammatory markers, which are actually highly technical, before and after in their blood. So there was a definite increase in their inflammation in the system in response to walking on Oxford Street. Same people, then they made them walk in the Hyde Park. Hyde Park is a large park in London, and their lung functions improved. So this is the best evidence that we have that walking in the polluted area reduces your lung function. There is more inflammation in your blood, which will affect all the systems of the body. So therefore, reiterating that it is better to do indoor exercises than to go out.
And lastly, you mentioned that Delhi's air pollution is because of many factors. There is the weather, there are external factors, you have dust coming in from the Middle East. But the other major factors are vehicles and garbage burning and construction. How is it that the government, after all these years, still struggles to tackle these issues?
So this is a political question, but I would tell you the science. There was a very elegant study done by same Dr. Mukesh Sharma and Dr. Dwivedi from IIT Kanpur. They did a study in India, in city of Delhi, and they documented that if you do following things, your air pollution would be much less. And I will just narrate briefly. If you vacuum clean the roads 4 times in a month and wash them also, if you carpet the sides of the road with some kind of greenery, if you follow the demolition and construction activities with the norms which are well known, I need not narrate that. If you desox and denox the electricity generation plant, and there are machines which can do that, same electricity would be generated without emission of NO2 and SO2, which are the main outcomes of this. If you stop the municipal burning completely, and if you convert all the 9,000 tandoors from coal to wood into the LPG or electrical, and if you do what we call as carpooling, if you do all this, there will be at least 50% reduction in the air pollution, and this is a published study in the year 2016. So that is where we are.
And are there any lessons we can take from other countries or cities that have managed to do this?
That's an excellent question. So as I documented Chicago study, so that same study also says that China in 2014 had Beijing, especially China, had similar air pollution that we have in Delhi. And they took it on war footing. And their life expectancy has improved by 2.2 years. So there is solid evidence that if you, long-term evidence that if you improve your air quality, your health quality improves. So, and if you talk about California, 100 years back, they had pollution something like what we have in Delhi. 100 years down the line, their number of cars have gone up by 10 times and their air pollution has gone down by 10 times. It is only because of good practices including engine quality and fuel quality. So evidence is there. We have to follow it. There should be will on the part of policymakers.
You were listening to Three Things by the Indian Express. Today's show was written and produced by me, Shashank Bhargava, and was edited and mixed by Suresh Pawar. If you like the show, then do subscribe to us wherever you get your podcasts. You can also recommend the show to someone you think will like it, share it with a friend or someone in your family. It's the best way for people to get to know about us. You can tweet us at Express Podcasts and write to us at podcasts@indianexpress.com.